welcome back to Communal Expressions. I'm Richard Rice, and I'm here with my co-host, Eva Melton. How you doing, Eva?
Hey, everybody. I'm doing good, Richard. How are you?
I'm good. I'm good. Welcome back. And as we discussed earlier, we're continuing our series in response to the COVID-19 pandemic. And we really want to look at this crisis from multiple perspectives. And to continue that, we want to take a look at the public health aspect. And so today we're going to be speaking with Dr. Bertha Hidalgo, who is an assistant professor in the Department of Epidemiology and Associate Sciences in the UAB Nutrition Obesity Research Center. So welcome back, Dr. Hidalgo. How are you?
I'm good. Thank you for having me today.
Yes, definitely. Thank you for making time for us. We know that you, like the rest of us, are working remotely and practicing social distancing and whatnot. So we're glad that you could squeeze in some time because I know you have a lot of responsibilities that you're dealing with right now.
Thank you. Yes, it's an interesting time for all of us. And if I can just say that I am, as a public health practitioner, as an epidemiologist, very grateful to all who are able to practice social distancing. I realize that many of the members of our community are unable because they have to continue to work, and they too are crucial to maintaining some order, obviously, in how we're handling this response. And so many thanks to those who can stay home, and thanks to the people who continue to go and make sacrifices to figure out how to leverage life with school out and all of the other aspects of our lives that are impacting our day-to-day activities.
No doubt, and that's something that we want to continue to explore. We intend to speak with some folks in the service industry and some other people that, like you said, don't have the ability or the luxury to be able to practice social distancing. They're taking risks on our behalf,
right,
on behalf of the collective. Before we get into kind of talking about why it's important to practice social distancing, I'd like you to talk about what you do as a public health practitioner. Just on a day-to-day basis, kind of lay the foundation about, why we asked you to be our guest today.
Yeah, so thank you. That's a good question. I am an epidemiologist. And so epidemiologists are individuals who are trained in understanding how diseases move through human populations. We are tasked with the understanding the marriage of biostatistics, statistics, mathematics with biology so that we can estimate risk of disease, how likely someone is to have, in this case, for example, COVID-19, how it spreads through the population, what are the measures that need to be put in place so that we can, if we're early enough, contain it. If we've moved past the point of containment, how we start what we're calling mitigation strategies, which include preventing further spread. And so in my day-to-day life, I mostly work on chronic diseases. So type 2 diabetes, cardiovascular disease, metabolic syndrome, obesity, and I estimate genetic risk. I'm really interested in, what genetic predisposition do we have to those diseases? And then to some extent, how does the environment affect our genetic predisposition? Does it alter it in some way, right? Like, does it change what we would normally be predisposed to have or not have? But as we have, all been sort of thrust into this new pandemic of COVID-19, many of our efforts are being shifted to address this in real time and using our skills as epidemiologists, as health behavior scientists, as healthcare organization and policy scientists, to really address the multiple components that are affecting how we are going to mitigate a response to the spread of COVID-19 at this time, and specifically in the US.
Right. Well, that's good. That's very helpful. I wanted you to just talk a little bit about COVID-19, about what it is and how it differs from other viruses or variations of the flu. Also, I was doing a little bit of research earlier, or yesterday actually, and I took a look at this Event 201, a global pandemic exercise. Are you familiar with that event? It took place
I'm not
last
sure
year?
if I think I've heard of it, but I haven't actually taken a look myself.
Well, it was basically like a mock pandemic I guess it's a conference essentially, and then public health officials or experts from all over the world come to this conference, and they do a simulation with like a mock disease, mock virus, and then October of last year, there was a mock pandemic that was really based on the coronavirus or something very similar to it, in which basically under this particular scenario, after 18 months, there were over 65 million people who had died in this, this mock scenario, and the virus really didn't kind of taper off until about 80 to 90% of the population had been infected by the virus. Is that consistent with what you're seeing now, or is that just? I mean, because to me it seems odd that this mock pandemic was put in place like in October, and then I guess the first case was found in China in December maybe, I guess, was identified.
Yeah. So so there are a lot of questions that are built into what you just brought up. So I will say that the scientific community, has anticipated an epidemic, a pandemic for many years. So, we had the 1918 flu that wiped out a significant portion of the population. Since then, scientists have been preparing for something like it. And in that time, we had MERS, which is, also a coronavirus. We had SARS back in 2002 and 2003. What prevented those two viruses from spreading to the effect that this coronavirus has spread is that they were simply less infectious than the SARS-CoV-2. So if I can back up for a second. So the way I explain this to my kids, coronaviruses is like the family, right? And then within that family, there are a number of members of that family. And in this case, those are the viruses. And so there's a virus that caused the SARS disease. There's a virus that caused the MERS disease. There is a virus that causes the common flu and the common cold. And so the new virus that has come out of that family is this SARS-CoV-2 virus. And what is making COVID-19, so the disease that is caused by the SARS-CoV-2 virus, different from, say, the common cold or the flu, is that evidence so far suggests that you can transmit the virus from person to person if you are asymptomatic or if you are pre-symptomatic. So in a phase where you don't really fully know that you're sick, you may still be able to transmit the virus to somebody else by coughing or sneezing, or coughing into your hands and touching surfaces that someone else will come behind you and touch. And so that is what's making this particular virus and this particular disease harder to contain than some of the other viruses where, as soon as we know that we start coughing and sneezing and we have a fever, we're like, oh, I think I'm sick. And we tend to sort of isolate, right? I mean, there are those of us who have to continue to go to work and, get other people sick. That's why you see like whole classrooms and, in school sometimes out for like a stomach virus or the flu because, someone who was sick went to work or went to school. In this case, continuing life as usual is simply enabling people who don't currently know that they're sick to infect other people. So this pandemic exercise that you described, is put in place because this is something that we have known for some time. And so what it does is try and simulate what things you could do to get it under control. What makes this also very different is that, we simply have no immunity for it. This is a new virus. We don't have built-in immunity in the human population. So in modern history, we haven't seen this virus before. We don't have a vaccine for it currently to prevent it. We don't have sufficient tests that we can use to test everyone who is either asymptomatic, pre-symptomatic, symptomatic, so that we know exactly who's sick, so that we can isolate them. And we don't have an effective treatment. There are medicines that we're trying at this time that we think work for some people and not others. You may have heard in the news today that UAB is going to be a site for a trial for remdesivir, which is an antiviral medicine that we think is going to be effective for treating COVID-19. But that still has to be tested and established as something that we can use, you know, for everyone who gets sick, much like we use Tamiflu for the flu.
Excellent. That's great. I hadn't heard of that. No, that was a good response. That was a nice pivot at the beginning as well of your response. But I understand. And a lot of these things, if you're an expert in this field and you see a certain set of criteria, and then that creates an environment that's right for this type of situation. So it's not a matter of being clairvoyant. It's just about reading the data and obviously interpreting it from your professional perspective. And that makes perfect sense. And so this idea of social distancing is, like you said, is based on the fact that COVID-19 is so much more infectious than the other types of flu viruses that we are accustomed to. And a lot of times, folks don't even know if they're affected or not. So I just wanted to ask you, like, what do you think about how long, I guess for right now, most of the directives or orders that we've received from a local and state government have been put in place until I think maybe April 6th or right around that time frame. You think that date is likely to be extended, and if so, for how long?
Yeah, that's a good question. If you have not yet seen, UAB sent out correspondence today indicating that we will be extending the period that some people are going to be working remotely. So there is now correspondence from the university about that. I would say that I have never worked in radio. I'm going to try and give an example. I've never worked in radio, but I have, seen like the control panels that are used to adjust the sound, right? Like either for music or for these podcasts or what have you, so that you have clarity and whatnot. So the way I envision it is that there are a number of things that have to be in place in order for us to be able to reduce the efforts for social distancing at this time. Right now, as I mentioned, we don't have widespread testing, so we don't have comprehensive testing across the US. We don't have a certified treatment that we can say everyone who gets sick gets this drug. We don't have a vaccine. We don't have enough protective equipment for our nurses and doctors and everyone who's working in the hospitals. We don't have sufficient beds, ICU units, or ventilators for everyone who gets sick. So if you think of each of those as sort of a lever or a one of those channels, right, that you have to adjust. And if social distancing is one of the things that you have to adjust in order to be able to say, okay, we have a handle on this situation, until you can get all of those to sort of even out, we won't be able to effectively remove the social distancing part of the equation, or move it out of the equation, because we simply need people to not be around each other and continue this spread. So Dr. Fauci was on Instagram Live today with Steph Curry. I highly encourage that if people are on Instagram, they go and listen to that Q&A. It's saved on Steph Curry's Instagram. I think it's Stephen Curry 30 is his handle. And he answered a lot of these questions as well. And one of the ones that was brought up was this idea of, how long? And you hear a lot about, well, if, you know, the majority of us aren't going to get sick, then what's the big deal? Like, why can't just the old people stay at home? Well, what we know is based on what data we have obtained from the countries who've already gone through this. And one of the countries that's gone through this is China. The other country that's gone through this is Italy, you know, like in very extreme, massive scales. What we currently don't know about the US is how it will affect our population. And what we're starting to see in the US and what we started to see in Italy is that young people who are healthy, we don't see any underlying conditions, are also affected, right? Now, this isn't a large proportion of the population, but the fact that we are seeing this not exclusively in the elderly, I think is reason enough to suggest that anyone is at risk, right? Not to mention also that if our hospitals are overwhelmed or near capacity already because of the number of people who are getting sick from COVID-19, if you're driving to work and you're in a car accident and need an ICU bed or a ventilator, or if, you know, like with my two kids at home right now, I'm like, we cannot go to the ER. Like everyone needs to sit down and read a book. We can't get hurt right now. If there is any other emergency, it is a toll on our hospitals and our healthcare workers. And so what we really need at this point is to spread out. Like, we know that a large portion of the population is going to get sick with this. We believe that a large portion of the population is going to have mild to moderate symptoms. Moderate does not mean that you don't feel sick. The people who have had moderate symptoms say that they don't wish this on anyone. It's a lot worse than the flu. It's still simply too early to tell. And so the best that we can do in the absence of having comprehensive testing, in the absence of having everything that our hospitals and healthcare workers need, is this social distancing effort.
Perfect. Thank you for that. Eva, did you have any questions?
Yeah, so in response to that, you know, out of all the statistics that you just mentioned and our unknowns, like with all the unknowns that we have, how do we continue to encourage the general public that they are making a difference with the social distancing?
Yeah, that's a good question. And, you know, this is not a situation where there is instant gratification, right? You don't stay at home for a week and you say, oh yes, I can see this tomorrow. This had a huge effect on our hospitals. Something that I think not everyone understands is that the cases that you see on the website for the Alabama Department of Health, or that you see in some of the counters that are online, or even some of the, you know, count curves that are being published on multiple websites, is that the cases that you see today were infected 1 to 2 weeks ago. And so there is a lag time that is really hard to describe to people, right? So the social distancing that we're doing now is going to have an effect later. Wow. And we will only know that through our continuous counting of the known cases that we are seeing in the hospitals, because there are a lot of people, probably even among your audience, who probably had symptoms, tried to get a test and could not get a test. So we have probably more cases of COVID-19 than we know about, right? Until we get more tests, we will not know exactly how many people out there have been affected and how many people remain to be affected. And so it's really important to continue as best as possible to continue to, you know, employ these social distancing measures as much as they can for the people who continue to work. So for example, my husband works in cell phone sales, an authorized retailer for Verizon, which means that, you know, they are an essential technology service much like grocery workers, much like a lot of the people that have to continue to work. And so we just have a protocol in place where, you know, he comes into the house, he strips in the garage, he washes his hands before he touches anything in the house. We know that this virus spreads mostly through the droplets that come out of your mouth and nose. And but it's hard to tell if he has touched any surfaces that are contaminated. And so washing one's hands as best as possible and as frequently as possible if you continue to work is really important. The virus is basically like a, you know, a little cluster of genes, and it's surrounded by this fatty lipid covering. And so soaps and detergents are really effective at dissolving the covering, and it basically like tears the virus apart. That's like very like rudimentary, but it basically breaks it apart. And so hand washing is really effective. Anything that will also break it apart, like the bleach solution. So a lot of my friends work in daycares, right? And so for those that are still implementing, providing daycare services for those essential workers, using a bleach solution or using Windex, which also has detergents in it, is really important. So, you know, there are things that you can do if you have to continue to work. If you can stay at home, stay at home. And I think also know that social distancing does not mean social isolation. And so that you can go out and go for a walk, go for a bike ride, try to stay away from people that aren't in your immediate household if at all possible. You know, at this time, all I can personally recommend, and the recommendations that are coming from the CDC and the World Health Organization, are that social distancing until we have these other measures are the best that we can do.
That's awesome. That's awesome. And I follow you on social media, so I saw that you posted this week. As a pastor, I've been seeing a lot of people, and even myself, because I'm working from home from my full-time job, but the isolation that can come. And so how do you work around what we may consider, hey, it's a weakness that I can't be alone, but really it's a temporary situation you've never been in. And so being able to work around that and keep your social distance and still be able to interact with people, that is just, I feel like it's so much helpful for us keeping ourselves emotionally and spiritually okay.
Absolutely, yes. I think a lot of the uncertainty breeds panic. And panic can lead to decision making that isn't conducive to continuing to prevent the spread, right? And I totally get that. I have parents who live in Los Angeles. My heart is torn for, you know, about the fact that I cannot be with them, that I can't be there to protect them. I miss my friends. My son has not been able to play baseball, you know, and the kids miss their school friends, and we don't go to church, that we watch church on a live stream Sunday mornings. You know, we're doing house party, the house party app to talk to all our friends. It's kind of like Hollywood Squares for those of us that are old enough to remember Hollywood Squares. And so there are a number of things that people can do to make sure that they still remain connected without necessarily being physically present, you know, and around one another, which I know is really difficult. And I think it's, you know, because there is that delayed gratification, it's just, I get it. It's really difficult and hard.
Yeah, that's important. And just, I think, changing the language to let people know that it will be a delayed gratification. And so that's helpful to me. Richard, I'm gonna toss it back to you.
Okay, well, good. So yeah, I mean, I guess my question is more like from a policy standpoint right now. We had a city of Birmingham who's entered the shelter-in-place ordinance within the last day or so, just basically saying if you don't have a non-essential job and if you're not headed out to pick up food or get medicine, you know, some type of emergency, things like that, recreation even, if you're not doing one of those types of things, stay home. That's obviously a very strong policy. Some people may say it came too late. I think, you know, it's a great initiative to do now. Jefferson County has issued a similar type of order or directive in regards to non-essential businesses as well. And I understand that the governor has formed a task force. Saw that you had, you know, posted some information about that task force on your website there, on your Facebook page as well. But also just kind of taking a look at from a global perspective at some of the other countries' responses. Is there anything that you've seen in some of these other places that maybe we aren't doing that we should do, or maybe we should be doing more of?
Yeah, that's a good question. Some of the places who have been most successful at tackling the continued spread of COVID-19 are places that instituted very stringent stay-at-home or shelter-in-place orders, right? I understand that the terminology for shelter-in-place has a different connotation based on sort of the history of the US. Some people, like in California, have chosen not to use it. I think Governor Cuomo has spoken very eloquently about why you don't use shelter-in-place.
Right.
So if we refer to it as a stay-at-home initiative, you know, the initiatives for stay-at-home that were instituted in China for Wuhan really helped control the spread. Again, you know, in places like Singapore and South Korea and other places that have been more effective at controlling it, there has been a lot more testing, right, that has been put in place as well. So when you go back to this idea that all of these different things have to find a balance, a lot of that has to do with the ability to test comprehensively. And until we can achieve that in the state of Alabama, but beyond, right? Because this disease, this virus does not respect city, state, national borders, right? And so we basically all have to be on the same page. And I think, you know, Mayor Woodfin, I'm not familiar with the, you know, what information went into instituting this stay-at-home order for the city of Birmingham, but what I do know is that there are a lot of people that live in the city of Birmingham that work at UAB. And who work at the hospital and who are not only themselves at risk, but could put others at risk. And so his decision to move forward with that may have had, in part, something to do with the fact that the risk of the people who are working at UAB is elevated and could elevate risk for others as well. And that's, you know, my speculation. I don't have any data to support that.
Definitely, I get it. You know, in these areas that are more densely populated, obviously, then there's a greater risk of the virus, you know, spreading more quickly. I think there's some other reasons maybe behind it. As you mentioned, we don't have comprehensive testing, so I've seen some data showing that there aren't very many cases in the Black Belt. You know, maybe people aren't traveling as much there, and is, you know, more sparsely populated. But there may be some other factors contributing to that as well. And you know, I think one of the things that I saw too, in reading up on it, is that the testing that was done in some of the other countries that you mentioned, Taiwan in particular, the folks were able to get results more quickly. Like they were able to get results the same day or within a few hours, whereas, you know, folks here are waiting a week. I've heard, and some folks have even waited longer than that. That's even after they began to show symptoms, you know, and they haven't received a diagnosis. So what is it? Can we do anything about that, or where's the gap? Why don't we have access to those same types of tests that allow us to have results more quickly?
Yeah, that's a complicated answer, actually. I will say that what we do have now is a faster test that is supposed to be distributed to people now more frequently and with greater numbers. And so as soon as we can start implementing that faster test and in larger quantities, I think that that will alleviate some of what we've been seeing with this lack and or slow testing that many people have experienced. I mean, I've had friends that have said that they, you know, were not able to get test results for longer than 5 days. And so, you know, I mean, it's a factor of, it's a consequence, I would say, of the fact that this was not something that was coordinated from the get-go to, for example, engage the private sector who does this so well and so efficiently. from the start. And so, you know, it's well known that the CDC developed a test. The test was faulty. They had to redesign the test. The test then went out in limited quantities to the state departments of health. At some point, they then moved to allowing high capacity labs to design their own tests, and then universities started designing their own tests. And so I think that there has been a little bit of a slowing of the process that made us lose some time.
Right, definitely. Yep. But I mean, that's positive, at least that we're aware of the issue now and hopefully it's being addressed. So I think that many of the other policy concerns, as you mentioned, like as we have more information, specific data about the individuals, then we can tailor the response and, you know, maybe not have as much collateral damage, so to speak, from, you know, economic and social standpoint. I think that we really do have to value life first, you know, and make sure that we do everything we can to reduce the incidence of death that's caused by this disease. But if we had more specific data about who was actually sick and then who had been in contact with the folks that were sick, then those countries have made more specific type of policy responses, and that puts less strain on everyone socially and economically. But we've been limited in that type of data, you know, just kind of reading between the lines there, you know, which has really kind of made this problem, you know, exacerbated it in so many ways. And you know, so I think that really is a testament to why it's important to have good leadership and good government, you know, because with us being able to look at all of these other cases that, you know, had their first case documented 2, 3, 4 months ahead of us, it really puts us in a place, I think, you know, to kind of extrapolate that information and see how it may impact us, but then able to look and see how those elected officials, which, you know, the dynamics are different in other countries, you know, maybe not dealing with 50 states and 50 governors and all that type of thing,
right.
But there's other factors, but, you know, competency is one too.
Yeah, we in the United States cannot impose some of the draconian measures that like China and other places have put in place. We you know, the directive at the onset was very much that each state would, you know, navigate as they felt would best suit their state. And, you know, if you look at the data, these mini epidemics within states aren't happening everywhere in the state, right? Nor are they currently happening in the magnitude that, say, for example, New York is experiencing in every state. And so there was language that came out today about assessing high, medium, and low risk counties and making plans accordingly for that. I would say that Birmingham is one of the places where we're most populous in the state. There are colleagues of mine that are very interested in the impact that this is going to have on rural communities as well, not only in the state of Alabama, but beyond. I will tell you that on the scientific front, we are trying to move mountains, but doing so in a very careful way, because faster doesn't always necessarily mean better, right? Or more accurate. Mm-hmm. And the last thing that you want to do is move so quickly to get something done that you do it poorly. And so I will tell you that, you know, we're working across scientific lines. We're collaborating with other universities. UAB has been fantastic in their response in, you know, leveraging all of the expertise that resides within and outside of the university to try and see what things we can do to develop antibody tests, to institute widespread testing, to determine who's currently infected and who's not currently infected. You know, all of the work that went into trying to get UAB as a site for this remdesivir trial. I mean, there is a lot of work that is happening behind the scenes. And so, you know, sometimes to someone like me, though I recognize that the stay at home and social distancing asks also create a lot of barriers and significantly impact lives. in comparison to everything that's happening behind the scenes, it feels sort of like, please, like, just stay home. You know?
It's one simple thing that we can control out of all of this, you know,
Yes,
unpredictability and uncertainty, you know? Yeah.
absolutely.
So I think we're getting close to the end. We appreciate your time. Definitely want to be respectful of that. I saw that there is a shortage of blood because
Yes.
been contributed to by the COVID-19 pandemic. Talk to us about, you know, how that occurred, and, you know, obviously what we can do to help is kind of clear, but and if there's anything else that you wanted, that you can call to action to leave our viewers and listeners with.
Sure. So yes, there is a significant shortage for many reasons, but you know, one of them is that as people were asked to stay at home, there was less of a propensity to be out and like participate in these blood drives. More people are getting sick, and so that also reduces the number of people who are able to go and give blood. I think too that you know, because so many resources were directed to treating the patients with COVID-19, there had to be a plan B or a backup plan to try and get these blood drives in place as well. They had to move the blood drive location from inside of UAB over to like somewhere on 280, and then there are other places throughout the state where this is happening. So yes, I mean, if you're staying at home and you're healthy, absolutely go and donate blood. It's really, really needed. Somewhat tangential but related to that, there is something that other states are trying, where with the blood of people that they know have recovered, they're using what they call convalescent plasma. And so they're using the plasma from the people who have had COVID-19 and gotten better to treat the critically ill for whom they cannot get like drugs like remdesivir and some of the other drug combinations that they're trying on people. So there is a lot that can be done right now with blood, especially blood donations. The plasma that they get for this purpose is separate and different. Obviously, you have to have known that you tested positive, that you got better. That's a whole other separate issue, but reminded me, since we were talking about blood drives, that that's something else that's going on in the background.
Yeah, that's good. That's positive, you know, news to show that there's innovation happening every moment in terms of treating it, you know, because that was kind of one of my other questions, is like, what does this look like on the other side of it? You know, it doesn't go away completely, presumably. But I guess if there's a vaccine, then it doesn't have the same impact. But just talk about what that looks like, and then if you can just tell our viewers how they can follow you on social media, or you know, stay in touch with you after this show.
Sure. So again, I have heard this and read about this, but also it was reiterated on that Instagram Live today with Dr. Fauci and Steph Curry. We do expect to see COVID-19 again. We do not know if the cases of COVID-19 will diminish or wane or decrease in number as the weather gets warmer, like we tend to see with the flu and cold, for example. We do not expect to have a vaccine for at least another year. And so what he said today is that in all likelihood, we would expect this to come back in the fall. What is being done currently is to prepare for that second wave if it happens that it doesn't completely go down by the time the summer hits, for example. The ways in which you would prepare is similar to what they're doing in China right now. They're building tons of ventilators. They're producing PPE, which is protective personal equipment. They are doing, you know, massive testing. They'll have testing in place so that when the new season begins for this, people would be able to get tested almost immediately. So this is not something, this COVID-19, that we expect to go away. And how much longer we remain with the current tactics that we're using, like social distancing, again, is going to come back to how quickly we can get all of this comprehensive testing and all of the other things that we need to be in order for us to kind of resume to a normal lifestyle. So in terms of where to get information, I will say that the CDC has great information. There is another website, coronavirus.gov, that has up-to-date information. The World Health Organization has information as well. That one is who.int. For those friends who are like, I don't trust the government, then they can go to, the Johns Hopkins website, which has great information. I have
our audience, apparently. Yeah, it's definitely a portion of it. Yeah.
So academics, we're very much about like, these are the facts. We have no political agenda. If you ask me what this is, I'm gonna be like, this is the virus and this is what it looks like. And these are the numbers and this is what the numbers say. On my website, shakenacademia.com, CHICACADEMIA.com, there is a tab that's called COVID-19 in parentheses, AKA novel coronavirus. And there I am putting a number of links to things that I have personally vetted that answer questions about like, what is COVID-19? Can I get takeout and curbside food? That was another big question with my audience was, am I really at risk if I go and get food that I'm not just like buying from the grocery store? Or can I get ship delivery? Or can I go to the grocery store and is that safe to bring in my house? I had a lot of questions like that. So it's not listed as an FAQ, but there are a number of links there that that are really useful to answer some of those questions. And then I've also created links if any of your viewers or listeners have Spanish-speaking populations that they are connected to. There are 2 links with Spanish information. The Hispanic Interest Coalition of Alabama has lots of resources as well. I've been working with them to some extent to get information out. So that's a 4th resource that people, actually that's I guess the 5th resource that people can have. Johns Hopkins and my page are 2 that are that I have personally vetted. There are others. Also, the UAB website has great information and a lot of graphics. So if your community members want to print PDFs that they can, email to people, I was going to say hand out, but we should not be handing out stuff. So if they want to email it to people or share it on social media, they can share. There are PDFs on the UAB website that are excellent. UAB has done a great job of curating information about coronavirus or COVID-19 as well.
Excellent. Well, thank you, Dr. Hidalgo, and we appreciate the work that you're doing. The professionalism and just making this information accessible. And thank you for making time for us for this show, for Communal Expressions today. Eva, do you have any closing?
No, I just want to tell everybody that you can find this episode and other episodes that we'll be releasing on this series on COVID-19 at communalexpressions.com. And wanted to tell the doctor we appreciate you and thank you for your time.
Thank you so much for having me. I sometimes feel like I'm speaking into a void. And so the opportunity to be able to share this information with your viewers and your listeners is most appreciated. So thank you for the opportunity.
No problem. Well, you have a great evening, good afternoon, and thank you again.
Thank you. You're so
welcome.
Okay, bye.